Hypertension, commonly known as high blood pressure, is a chronic medical condition in which the blood pressure in the arteries is persistently elevated. It is one of the most common cardiovascular disorders worldwide and a significant risk factor for serious health problems such as heart disease, stroke, kidney failure, and premature death. Understanding blood pressure. Blood pressure refers to the force exerted by circulating blood on the walls of blood vessels, particularly arteries. It is measured in millimeters of mercury, mmHg, and recorded as two numbers. Systolic pressure, the higher number pressure in the arteries when the heart contracts and pumps blood. Diastolic pressure, the lower number pressure in the arteries when the heart relaxes between beats. A normal blood pressure reading is usually around 120/80 mmHg. Hypertension is diagnosed when blood pressure readings consistently exceed 130/80 mmHg, as per the latest guidelines by organizations like the American Heart Association, AHA. Types of hypertension. Primary, essential, hypertension. This is the most common type, accounting for about 90 to 95% of cases. It develops gradually over years without a clearly identifiable cause. Genetics, lifestyle, diet, and environmental factors all contribute to its development. Secondary hypertension. This form results from an underlying condition such as kidney disease, adrenal gland tumors, thyroid disorders, certain medications, or obstructive sleep apnea. It tends to appear suddenly and cause higher blood pressure than primary hypertension. Causes and risk factors. Hypertension is influenced by a combination of genetic, environmental, and lifestyle factors. Genetic predisposition, family history increases the likelihood of developing hypertension. Age, blood pressure tends to rise with age due to arterial stiffness. Obesity, excess body weight raises blood pressure by increasing the workload on the heart. Physical inactivity, sedentary lifestyle contributes to weight gain and cardiovascular risk. High salt intake, excess sodium causes the body to retain water, increasing blood pressure. Excessive alcohol consumption, heavy drinking can raise blood pressure. Stress, chronic stress may increase blood pressure through hormonal effects. Smoking, tobacco damages blood vessels and accelerates arterial stiffness. Chronic conditions, diabetes, kidney disease, and sleep apnea often coexist with hypertension. Symptoms. Hypertension is often called the silent killer because many people with high blood pressure experience no obvious symptoms, even when levels are dangerously high. This asymptomatic nature means that regular screening is essential for early detection. When symptoms do occur, they may include headaches, especially in the morning, dizziness or lightheadedness, blurred vision, nosebleeds, shortness of breath, chest pain, in severe cases. However, these symptoms usually appear only when blood pressure reaches a severe or crisis level. Diagnosis. Diagnosing hypertension requires accurate and repeated measurement of blood pressure. Doctors use a sphygmomanometer, blood pressure cuff, and may take several readings at different times to confirm the diagnosis. In some cases, ambulatory blood pressure monitoring or home blood pressure monitoring may be recommended for better accuracy and to rule out white coat hypertension elevated readings only in a clinical setting. Additional tests may be ordered to identify secondary causes or assess organ damage, including blood tests, kidney function, cholesterol levels, urinalysis, electrocardiogram, ECG, echocardiogram, heart ultrasound, kidney ultrasound. Complications. If untreated or poorly controlled, hypertension can cause significant damage to vital organs. Heart, increases risk of coronary artery disease, heart failure, left ventricular hypertrophy, and heart attack. Brain, raises the chance of stroke, transient ischemic attacks, mini strokes, and cognitive decline. Kidneys, can lead to chronic kidney disease or kidney failure. Eyes, may cause hypertensive retinopathy, leading to vision loss. Arteries, accelerates atherosclerosis, hardening and narrowing of arteries. Treatment and management. The goal of hypertension treatment is to reduce blood pressure to safer levels, minimizing the risk of complications. Management includes lifestyle modifications and, if necessary, medications. Lifestyle changes. Diet, adopt a heart-healthy diet like the DASH, dietary approaches to stop hypertension, diet, which emphasizes fruits, vegetables, whole grains, and low-fat dairy while reducing salt and saturated fat. Exercise, engage in regular physical activity, at least 150 minutes per week of moderate intensity exercise. Weight loss, achieve and maintain a healthy weight. Limit alcohol, keep alcohol consumption within recommended limits. Quit smoking, eliminates tobacco-related vascular damage. Stress management, techniques such as meditation, yoga, or counseling can help. Medications. When lifestyle changes are insufficient, doctors prescribe antihypertensive drugs. Common classes include diuretics, help the body eliminate excess sodium and water. ACE inhibitors, relax blood vessels by blocking angiotensin-converting enzyme. Angiotensin II receptor blockers, ARBs block the effects of angiotensin II, relaxing arteries. Calcium channel blockers, prevent calcium from entering heart and vessel muscle cells, reducing contraction. Beta blockers, slow heart rate and reduce cardiac output. Medication choice depends on individual health conditions and side effect profiles. Prevention. Preventing hypertension primarily revolves around maintaining a healthy lifestyle. Eating a balanced diet low in salt and rich in nutrients. Maintaining a healthy weight. Staying physically active. Avoiding tobacco use. Managing stress effectively. Regular health checkups for early detection. Conclusion. Hypertension is a pervasive health issue that significantly increases the risk of life-threatening conditions like heart attacks and strokes. Despite its often silent nature, it can be effectively managed and controlled with lifestyle changes and medications. Awareness, early diagnosis, and consistent treatment are key to preventing its serious complications and improving overall health outcomes.
Thank you for watching. Please subscribe our channel.